And it looks like by taking the pills on a more regular basis, some of the cardiovascular bad things that we see in the blood actually start to get a little bit better. So there's just research coming out on this, but it makes me even more comfortable prescribing these medications. So take the pills about an hour before sex. Ensure that there's adequate sexual stimulation. These pills only work when you're aroused. So unless you're into men, don't take a pill, watch a football game, and expect to get an erection. You have to be sexually aroused. You have to have sexual stimulus to trigger off the whole mechanism of this. And if it doesn't work the first time, try again. Okay? Just be patient with this and try to keep working with them. Talk to your doctor about increasing the dose and just see whether or not these can work. But if they don't, there's other medical options. And one of them is actually bypassing all the nerves and bypassing that arousal pathway and actually injecting one of the chemicals directly into the penis that will relax that smooth muscle and give you an erection. And there's urologists in town and other people that can help you get the proper dose for this medication. Or forget medication altogether. You can actually use a vacuum device that draws blood into the penis and then a small ring at the base, which is hardly bothers anybody, can hold that blood in there for about 3/4 of an hour, and then you take the ring off. So these are other methods. And lastly, if every reversible way of trying to get an erection fails, you can look at having a penile implant. You need to see a urologist for this, but this will give you an erection either with sort of a pumping mechanism or kind of like a gooseneck kind of mechanism so that you can have an erection that's firm enough for intercourse. All of these erection methods do not change your libido or your ejaculation or your sensation. Okay? So they're all just for erection enhancement. So most of the time we can figure out some way to help with your erection. In most men, the pills work. Depending on what the problem is, somewhere between 50 and 80% of men will work. If you've got really significant diabetes, really, things that really interfere with that lining of your blood vessels, you need higher doses of the pills. Again, if you don't work, there's other options. The second line therapy that I showed you that slide on, that will take care of almost 90% of the other patient load. And actually to do penile implants, that's only about 1% of men. And again, Dr. Tao is going to talk about this, but remember your partner. Okay? It's not just about genital function, it's about how you and your partner communicate, because that's part of your arousal. So the communication with your partner's very important, and she'll address that. Thank you.